My name is Dr. John William Aldridge. I'm an orthopedic spine surgeon here in Newport News in Williamsburg, Virginia. I've been here in practice approximately 16 years, treating all sorts of orthopedic conditions, but I primarily do spine surgery, total joints, and some sports medicine. Today we're talking about the sacroiliac joint specifically, which is a common cause of low back pain, especially after trauma or after prior surgery, or even after pregnancy. So the sacroiliac joint is at the bottom of the spine, or it's where the spine meets the pelvis. We have two of them, one on each side of the spine. It's a very structurally strong joint, connected by heavy ligaments, and therefore it really doesn't move very much, maybe 1 or 2 millimeters at a time. Out of all the patients who come to see me for low back pain, I'd say about 10 to 20% have sacroiliac joint dysfunction. So these patients look like typical low back pain patients. A lot of them are hunched over, have a noticeable limp. They favor one leg versus the other, or sometimes they even hold the side that hurts as they walk in. Some people can feel like they have a pinched nerve or sciatica, and it can really turn out to be the sacroiliac joint causing their problems. So sacroiliac joint patients often present with low back pain, most commonly on one side or the other. It should be specifically really located over the sacroiliac joint to pinpoint it as a sacroiliac joint dysfunction. Anyone with sacroiliac joint dysfunction really suffers with any activity that involves prolonged positioning in any one position. So I get patients who come in and say they can't lay down for more than 30 minutes, they can't sit for 30 minutes, they can't stand for 30 minutes, because that constant pressure causes a lot of pain. First, listen to their history of what they've been through, where there are complaints, where is their pain, how does it radiate, does it radiate, and where is it located. Then I'll examine the patient and I'll put them through just palpation tests. I'll examine the other parts of the body, including the hip and the knee and the low back, to see if there's other issues causing their pain. And then we'll do some provocative tests, which means we'll stress the sacroiliac joint by pushing and pulling on that joint by putting the leg in different positions to see if we can increase the pain. And then the last step would be, if that is all positive and indicates that they have a sacroiliac joint dysfunction, we may do a diagnostic injection with some numbing medicine to kind of numb up the joint and see if the pain will go away. We treat all sacroiliac joint patients through conservative care first. So we start with some anti-inflammatories, gentle home stretching exercises. If those things don't work, we often move on to formal physical therapy and chiropractic care. And then we'll try some cortisone injections into the sacroiliac joint. There's also a thing called radiofrequency ablation, where the pain management doctor can numb up the nerves that innervate the sensation to that sacroiliac joint, and that can give them good pain relief for a temporary bit. If a patient fails conservative care and nothing will give them lasting benefit in terms of pain relief, then we can talk or discuss the sacroiliac joint fusion, which should give a permanent fix for their sacroiliac joint dysfunction. The iFuse is an implant designed by SI Bone and has been pretty extensively tested and studied by them. They have the most clinical results I've found in the literature in terms of long-term results for the SI Bone fusion. It's triangular shaped implants that we prepare the bone to a slightly smaller space and then impact those through that prepared bone through a percutaneous or 1-inch incision. Usually we like to get 3 of them in optimally, but sometimes we can only get 2 based on how big or small the patient's anatomy may be. So the recovery after a sacroiliac joint fusion, typically we do some limited weight bearing from 4 to 6 weeks based on bone quality, but typically between 6 and 8 weeks the patient's pretty fully functional with maybe some residual soreness or achiness. So I would say the recovery time is probably about 6 to 8 weeks. The actual surgery takes anywhere from 30 minutes to 60 minutes based on the patient's anatomy. I keep them at limited weight bearing for about 4 to 6 weeks. I like to return to the full activity around the 2 to 3 month mark, and that's about the time it takes the biology of the patient to grow into the implant and make it a solid fixation, really solidify that sacroiliac joint fusion. In conclusion, the sacroiliac joint is a very common cause of low back pain. Oftentimes it's misdiagnosed or underdiagnosed by others in the community who aren't as familiar with the sacroiliac joint. We here at Hampton Roads Orthopedic Spine and Sports Medicine would be happy to take care of you and your pain. So please visit our website or give us a call.